Minor cuts and scrapes are common injuries that can usually be managed at home. First, wash your hands and gently clean the wound with clean running water to remove dirt. Apply gentle pressure with clean gauze or a cloth to stop bleeding. An over-the-counter antiseptic may be used according to the product instructions, and the wound can be covered with a clean adhesive bandage or sterile dressing to protect it while it heals. Avoid repeatedly using harsh chemicals that may irritate the tissue. Seek medical attention if bleeding does not stop after applying firm pressure, the cut is deep or widely open, caused by a bite or dirty/rusty object, contains embedded debris, or shows signs of infection such as increasing redness, swelling, warmth, pus, or fever. Also check whether a tetanus booster may be needed.